Hello, folks. Well, thank you for joining us today for the EMPOWER Advocacy webinar. My name is William Marchand, and I am the National Coordinator of Engagement, Education, and Support. And I would like to thank you all for joining us today. I would like to start out by starting our meeting in a good way with a land acknowledgement. So I would like to start our meeting in a good way by acknowledging the Indigenous peoples whose traditional territory I am calling in from today. I would also like to respect the long-standing relationships of the three local First Nation groups of this land in place in southwestern Ontario. The Adirondack peoples once settled this region alongside the Algonquin and Haudenosaunee peoples and used this land as their traditional beaver hunting grounds. These three long-standing First Nations communities of this geographic region are the Chippewa of the Thames First Nation, the Oneida of the Thames First Nation, and Munsee Delaware Nation. I wish to also acknowledge the long history of the First Nations, Inuit, and Métis people in Ontario and show respect to them today. I would also like to acknowledge the many long-standing treaties relationships between Indigenous nations and Canada. We recognize that all levels of government in Canada have a responsibility to honor the nation-to-nation relationship, and that individually we all have a role to play in honoring the treaties and contributing to reconciliation. Thank you. So now I would like to introduce our Executive Director, Nicola Worsfold. So thank you, Nicola.
Thank you so much, William, and hello, everyone. Thank you for joining us this evening. I also want to say Happy New Year. It is 2026, and I'm really excited that we are launching our 2026 educational programs with a focus on advocacy. And today's session is going to be focused on our advocacy efforts. Advocacy is an important priority for Defeat Duchenne Canada. It is, if you can go to the next slide, please, Rafaela. Advocacy is one of our four strategic pillars, and it continues to be a very large focus for the organization as we continue to fight for access to medicines, particularly in light of Health Canada's approval of vamorolone, as well as access to the best care for Canadians living with Duchenne. I'm also excited to share that we are actively starting our interview process for our Director of Advocacy. This individual will be responsible for leading our advocacy initiatives moving forward. In the meantime, we have been very closely working with an organization called EMPOWER Advocacy. This organization focuses primarily on amplifying voices of communities like ours to drive positive and lasting change within the healthcare landscape. Now, many of you have met the two lovely ladies that are joining us today. So we have Joanne, who is the CEO, and Lauren, who is the Vice President of EMPOWER Advocacy. Both of these lovely ladies joined us back in October at our family forum where they presented the first session, which was on understanding the Canadian drug approval process and where your voice matters. This evening session is part two of this three-part series, and this session will focus on how to become an effective advocate. So please join me now in welcoming both Joanne and Lauren. Thank you both. The floor is yours.
Great. We'll just get our slides up. But thank you very much, Nicola, for the introduction. We'd like to say hello to everyone who has joined us this evening. As Nicola, excuse me, mentioned, this is the second of our three webinars about advocacy. And tonight, we're going to discuss why your voice matters throughout all of the processes involved in specifically drug approval and reimbursement in Canada, and how you can become an effective advocate. So let's get started by taking a quick look at our agenda. So here are the topics that we're going to cover. I'm going to start us off with a bit about what advocacy is, why it matters, and what goes into building an advocacy plan. And then my colleague Lauren will take you through how to put your advocacy plan into action for public reimbursement, including how to tell your personal story, which is a very important component of advocacy. So as you can see, we have set aside some time at the end for a brief Q&A. So please note down and submit any questions that you may have as we go. But we're also happy to answer questions anytime after this webinar through Nicola and the DDC team. So let's do a little recap of session 1. We hope that everyone has had a chance to watch the recording of the first webinar online, or perhaps you watched it live at the Family Forum in Toronto. But I know that was a while ago either way. So let's start with a quick recap of what we covered. So this is a busy slide, but we do think it sums it up best. What we discussed on our last session, and we reviewed with you all of the processes that you see here, from approval of a new treatment through to patient access. And you'll recall that once a drug is approved by Health Canada, it can actually be sold here. And as soon as the manufacturer has product available, which isn't long after approval usually, but the challenge is actually getting access. So we reviewed the 3 main access pathways on our last webinar. Those include public coverage, private coverage, and out-of-pocket, as well as compassionate access through the manufacturer under certain circumstances. We also talked about how it can take a long time, sometimes 2 to 3 years, for a drug to be publicly funded in any given province or territory, or sometimes longer, and that on the private side, reimbursement is now taking longer as well because of what's happening with public funding. They tend to follow or wait for that decision to be made. So as you can see here, the last step for public coverage is when any or all of the 19 provincial, territorial, and federal government plans sign up for signed product listing agreements with the manufacturer. But on the private side, signing PLAs is only the beginning. So let's take a quick look at the private coverage pathway. You might recall seeing this slide in our first presentation. It might seem more straightforward than the public one, but actually the number of payers and the wide range of variables in terms of plan design and reasons for declines actually makes it very complex. And so we talked about how PLAs need to be signed by each private payer. And there's more than 25 different insurance companies that need to do this. And that by signing a PLA, it means only that the drug will be listed on the private payer's formulary, not that will actually be covered for an individual patient. So from there, we talked about how each patient's drug claim is adjudicated, as you'll see going up the pathway, based on their own private benefits plan. And that will determine if coverage will be provided or not. And that there may be one additional step in this process called prior authorization, which is typically put in place for higher cost specialty drugs. And that means that patients must meet certain criteria to be covered. And remember that like most of the public processes, with private coverage, there are no formal opportunities for input. And that leads us really nicely to the next slide, which is the question that we asked at the Family Forum: where does your voice matter? Well, in fact, it matters everywhere. All of these steps or processes represent opportunities for you to engage in advocacy to influence public and private drug coverage decision-making. But as a reminder, as you can see here, there is only one formal opportunity for input from stakeholders like you, which is the HTA processes, a health technology assessment, one for Canada, excluding Quebec, one for Quebec only. So formal advocacy tends to be very prescriptive, and you're told how and when you can engage. We talked about that. We went through the templates with you on the last webinar so that you could see the kinds of questions that are asked. But as you can see here, there are many more informal opportunities for you to engage in these processes, and you can decide how and when you want to do it. And you can also see how many different targets there are for informal advocacy, which we're going to discuss in a little bit of detail in a few minutes. So let's dig in. What is advocacy and why does it matter? So this is where we ended the first webinar. So we thought we would review it again and expand from here. Regardless of why you're doing this work, first and foremost, we believe that advocacy is about empowerment. It's about supporting people to feel empowered to advocate, and it's about the feeling of empowerment that you get from doing it. Double benefit. So advocacy can be many things to many people, but you may have your own way of describing it. For us, it really, in the work that we do, advocacy is taking action to create meaningful change that will have a lasting impact on issues that matter to you and others in your life by doing a few different things. Bringing your perspectives forward and your lived experience on important issues, by building relationships with decision makers and influencers who can become your cause champions, and by positioning you and your organization as trusted partners in bringing about change. So let's look at the different kinds of advocacy. In healthcare, we tend to see these three, and what differentiates them is who or what is being impacted. So in some cases, starting on the left, a broad public policy issue can be having an impact on many people at a system-wide level. And so that is what we call system advocacy. In other cases, a limited number of people may be impacted by the same issue and choose to advocate together as a group. And that could be something like access to newborn screening or genetic testing. And then in the center, there is individual advocacy, which is when an issue is directly impacting you, a loved one, or someone who you're supporting. And that could be something like being denied access to a treatment through your private insurance, like we just discussed before. But often individual advocacy, at least we see, ends up helping others as well, and can evolve into group advocacy, or even in some cases, system-wide change. Very powerful. So whether you're a community, a group, or an individual, there are so many reasons why advocacy matters. This could be probably 4 or 5 slides long. But what we can say is it's important and impactful and can make a difference in people's lives. And here are just a few reasons why. So starting at the top, even though advocating to a decision maker can feel really daunting at times, typically we see decision makers react and respond well to people who effectively bring their issues to the forefront of the broader agenda. So when you can connect your issue with something that is on the government's agenda, let's say, if you're advocating to government. And similarly, governments that you are targeting will have their own competing interests. And advocacy really provides that opportunity for you to make your priority their priority. So what we love about advocacy is that it enables you to gain some control over an issue that is affecting you, often at a time in your life when you do not feel very much in control. And it enables you to ask questions and push when you need to around these issues that are important to you in your community. So you all know the squeaky wheel gets the grease adage. Well, advocacy can help you fill a void. And we can tell you that if you don't engage around an issue, it's very likely that no one else will, and then nothing will change. So be the squeaky wheel. And most importantly, advocating allows you to draw upon both the power and the right that we all have to make changes in our lives for the better. So now let's move on to the fundamentals of how you can build an advocacy action plan and that will drive change. And what we'll say off the top is that often it will be a patient organization like Defeat Duchenne Canada that will build an advocacy plan, but it's important for you to understand the components if you're going to be helping to carry it out. So let's get to it. So to build an impactful advocacy plan, we suggest that you ask and answer these 3 core questions. First, What's your problem? Let's start there. This is the issue that you're currently facing and that will become the focus of your advocacy. Second, what do you need to resolve your problem? This is the action that you need to be taken and the outcome that you need to see. And third, who can get you what you need? This is the decision maker who has the power to solve your problem. Now let's break these down on the next few slides. When living with any disease or condition, we are faced with many challenges and issues along our journey. So when we're choosing to embark on advocacy, it's really important to decide where to focus our efforts. And often it's the most immediate or pressing issue. But the key here is to tackle one at a time if you can. Sometimes that's not possible. Sometimes 2 things or 3 things are pressing and you've got to deal with them all at once. But if you're able to make that choice, and once you've done that, the next step really is to clarify what impact the specific issue or challenge is having on you or a loved one. So what problem is it causing? And the one thing to consider at this stage is that not all issues lend themselves to advocacy. So you can take this little test in the box. Simply ask yourself if your problem can be solved through advocacy, and can you identify who can solve it for you? And that is going to be your advocacy target or your decision maker, which we'll talk about more in a minute. All right. So once you've chosen your issue and clarified what your problem is, and that it can be solved through advocacy, start thinking about what needs to be done to fix it. And that is the solution to your problem. You can also think about your call to action. What specifically do you need to ask your decision maker for? And here are a few tips on this slide that you can review on your own to help you formulate these important components of your advocacy plan. And by this point, you probably have a good idea of who the target of your advocacy is or should be. And to make sure you're on the right track, ask yourself these questions. Who's involved? There may be a number of people who play different roles that could be supportive, influential, decisive, and it's important to know what role they play so that you know what your ask of them will be. Is your problem at the institutional level, or is it something that you need to go to government to solve? Sometimes it can start in one place and need to be escalated to another, and we're going to look at that on the next slide. You're also going to want to ask yourself, who are the people whose job it is to represent your needs? How influential are they around your issue? This could be a doctor, a specialist, a social worker, hospital administrator, an elected official, many different people you want to think about who can help you. And the most important thing to be clear about is who is the ultimate decision maker. That person is the target of your advocacy because they can give you what you need. All right, let's talk a little bit more about your target. So as you can see on this slide, you also need to know who to start with and who to escalate to if you're not getting what you need. Now, this is a bit of a busy, complicated slide, but it's important, so let's go through it in a little bit of detail. Let's say, to start off with, that advocacy is needed at the federal level with Health Canada. For example, if a drug is taking too long to be approved. Then typically a patient group, and that's the stuff in turquoise, would start by advocating to the federal health minister. And from there, you may need to escalate to the local federal elected officials if you're not getting the health minister's attention. And that would be your local MP or your member of parliament to put pressure on the federal health minister to pay attention to your issue. Similarly, on the next line, a patient group typically initiates informal advocacy with CDA if there are challenges with that process. And from there, you may need to escalate to the provincial level, which again is usually the patient group, going to the provincial drug plans who all sit around the CDA table, but more pressure might be needed from the political side because drug plans are bureaucrats, and that means you reaching out to your local provincial elected official. Okay, so you can kind of see how this is all unfolding and evolving. And we take the same approach with the Pan-Canadian Pharmaceutical Alliance as well at that stage. But when you're waiting for your province to sign a product listing agreement, you can get involved right off the top. You can target your local provincial elected official. Patient groups can focus on the drug plans. And if more pressure is needed, everyone can escalate to the provincial health minister and let them know that you need help. And so finally, when it comes to private drug funding, we suggest that you start with your insurer, but likely you're going to need to escalate to the ultimate decision maker, who is your employer or employer-sponsored benefit plan trustees. But the most important thing to remember is to give your target a chance to help you before escalating to someone else. All right, just a few more slides. Another thing that you can do to help ensure that your advocacy plan is effective is to consider the entire ecosystem of stakeholders who could potentially support your advocacy efforts. And here we have in these boxes some examples of who those could be. I'm not going to read them out, but you can see them. And certainly patient organizations are extremely important in this work. You will likely think of others when you're giving some thought to this, but what's important to remember is that you don't have to do this work alone. And we're going to come back to how you can leverage your network of supporters and advocacy in the next part of this session. But you never know what connections other people in your life may have that could be helpful, or how they themselves could help you. Which brings us to the last slide in this part before I turn it over to Lauren. So not only are there different kinds of advocacy to be aware of, as we discussed earlier, there are also different kinds of advocates or roles that people can play in advocacy. So we have the enablers, those who enable. They build the foundation, the resources, and the capacity needed to enable groups and individuals to take action. We have those that empower. They provide the tools, the knowledge, and the training needed to empower individuals to bring their voices forward. And we have those who execute. They are the ones who amplify the voices of patients and caregivers and healthcare providers to drive positive and lasting change. So give some thought to where you see yourself engaging and what role others in your network can play, and that you can play actually more than one role. So think about that as well. All right, I'm going to turn it over to my colleague, Lauren. You've heard me talk enough, who will walk you through how to put your advocacy plan into action. Lauren?
Great. Thank you so much, Joanne. So now that you've taken some time to determine your problem, what needs to be done to solve it, and who the target or decision maker is, and who can support you in this advocacy work, it's time to put all of that into action. So the following are 4 steps or key components for taking that advocacy plan from theory into tangible actions. Today, we'll be touching on the first 3 steps, and then the 4th step of overcoming challenges we're going to discuss in our next webinar. So starting with number 1, key messages. The cornerstone of effective advocacy is key messages. So before I outline what key messages are, I wanted to share that this is an area where an organization like Defeat Duchenne Canada can support. Joanne touched on our advocacy supporters and our role as different advocates. As a patient organization, in their role, Defeat Duchenne Canada will likely develop key messages that you can use as community advocates to inform the action that you take. So these key messages will be concise points that will guide you as you undertake your advocacy. So key messages outline what the problem is, how the problem can be solved or the solutions, and what's the call to action. So what the target can actually do. They are reinforced often with supporting points based on data and or personal experience. But the one thing that's really important to remember is that key messages should focus and include the ask. So what is your call to action? What are you asking your target to do? As a next step, we're going to discuss the advocacy tools, which are essentially vehicles for sharing your messages in a compelling way that will reach your advocacy target. You'll see on this slide there's a number of tools, And the type of advocacy tool you choose will depend on several things, including your target, the issue, what stage in your action plan you are. So is this the first target? Are you in an escalation stage? Or the urgency of your issue? You may also use more than one advocacy tool, which we're going to touch on in the next slide. But you may also find that your network, your ecosystem of supporters may each execute on different advocacy tools. So Defeat Duchenne Canada may utilize one of these advocacy tools, such as a petition or a newsletter, news release, whereas you may share your personal story or participate in meetings as individual community advocates, which I'm going to touch on even more on the next slide. So as I alluded to, what's important to remember when deciding on which advocacy tool is that you likely won't use all your advocacy tools at once, or you may use some more than once at different stages in your advocacy strategy. And this is what we call layering. So as you can see on the slide, you may start with a certain tool and move on to others as your issue progresses. As I kind of just alluded to on the previous slide, we may have a situation where at the first stage of advocacy, Defeat Duchenne Canada may put out a press release and some social media posts on the issue at hand. And then as a community advocate, you may be asked to prepare a personal story to complement this. In the next stage, Defeat Duchenne Canada may secure a meeting with a government decision maker and then invite you as a community advocate to join them. Then, as a final step, if your issue is still not resolved, they may host an advocacy day. And once again, as a community advocate, you may be asked to join and maybe to participate in a media interview where you share your personal story. So it may look complicated, but at its essence, it's about picking the right way or ways that you are going to take action. And it could just be using one tool at a time or using multiple tools to complement each other based on your role as an advocate. Now that we've discussed our advocacy tools at a high level, we're going to move on to the third component, which is leveraging your network. So building and nurturing connections with the right people is at the heart of successful advocacy. And this is where we come back once again to that ecosystem of advocacy supporters that Joanne mentioned on an earlier slide. Within that ecosystem, there may be others who share your concerns and whom you can work with to present a united front and deliver a consistent message, because more voices can help amplify your advocacy. Further, you may actually be a member of someone else's ecosystem of supporters. Over the course of all these slides, I've referenced ways that Defeat Duchenne Canada may ask you to join the work that they are doing, putting you in a position as their network. In the next advocacy webinar, when we talk about meetings with your advocacy targets as an advocacy tool, we'll also discuss the different ways you can leverage your supporters and specific roles that they can play in those meetings. So now we're going to focus on one advocacy tool in particular, and that is telling your personal story. So this is probably the most important advocacy tool you have at your disposal, and it's definitely the one to start with as you begin your advocacy work. So we're going to take a look at what a personal story is in advocacy, as well as some suggestions and tips for how to develop it. So a personal story is a very impactful advocacy tool as they help to frame the advocacy issue in lived experience. They bring a face to the issue and a personal connection to what you're speaking about. It can also help decision makers see beyond facts and figures and into how the issue is actually affecting Canadians like yourselves on a daily basis. So at a quick overview, what is a personal story? So it's a summary of what has happened to you as it relates to the issue at hand. It provides your perspective on the issue based on your experience, feelings, and attitudes. And it demonstrates how the issue has directly impacted your life or the life of your loved one. Importantly, a personal story should end by clearly stating what you need. So this is going back to that ask of the decision maker. The most important thing with your personal story is that there is so much to tell. Stories are complex and there are so many aspects, but we recommend keeping it focused on the issue you are facing and your ask. So, four main things to include are a bit about yourself and your family. So, details about your support network, about your family, some facts about your situation. So, this is how, your diagnosis, circumstances around it, and how it made you feel impacted your life. The issue or problem you are facing. So, very importantly, how this issue and problem is affecting yourself and your family, and why is this important to solve? So you're sort of the who you are, the who, the what the situation is, the what the problem is, why it's important, and then finally reiterating once again your ask. So this is your chance to tell the decision maker what they can do to help you. So what action needs to be taken. And we have this personal story Q&As to help you answer it. So there are many approaches to writing a personal story. And if you find yourself facing any sort of writer's block, one approach we suggest is asking yourself a series of questions. So just like a journalist would ask questions in their job to report on what happened, who made it happen, how it happened, etc., you can formulate questions that will help you get to your story. And of course, you also need to answer the questions you pose. So kind of think about it as interviewing yourself for a story about you. When Joanne and I conduct interviews with patients just like yourselves to help them write personal stories, these are the type of questions that we ask to help inform writing the story for the purpose of advocacy. So we find these questions as just an example of some that are very important. And now here is a personal story checklist that you can use as you're writing your personal story to make sure that you are hitting on everything that you need to hit. So verify that your ask is worded as diligently and as succinctly as possible. We suggest reading your story out loud more than once. To time it, you might only have a couple minutes to tell your personal story. Edit your story as needed to reduce repetition or unnecessary details. Practice delivering your story in front of a friend or a family member. And have your story ready to read in an easy to read format, such as printed or on a tablet or phone. I'm now going to hand it back to Joanne to wrap up and share a little bit more about what we're going to touch on in the next webinar.
Perfect. Thanks, Lauren. Such an important topic, your personal story. Really, it is your key advocacy tool that you have easily at your disposal. And, the thought we have now is that, once you have your personal story developed, and I'm sure you're thinking the same thing, what comes next? I mean, that's only one piece. So there is one more webinar. And in that webinar, we will talk about how to advocate effectively and with impact around issues that are important to you and your loved ones. And here are some of the topics that we're going to cover. So on that webinar, you will have your advocacy tool kit available to you, and DDC is going to share that. It will include information and materials that you can use to help you with your in-person or virtual advocacy. And we'll also talk about how to get and conduct successful meetings with your decision makers and to make sure that you have your one ask included in your messaging. And then lastly, we'll talk a little bit about overcoming challenges. So we'll help you to with some tips to keeping the dialogue going when the target of your advocacy says no or is unresponsive or just generally being difficult. So all of these things will be included in our webinar next time. So in between now and then, this is really the perfect time for you to work on your personal stories. If you decide to engage in advocacy work, regardless of the issue, it's a great time to really spend some time to do this, to develop them, look back at some of the slides that we've shared with some of the tips, and you'll be ready to take action by the time we get to our next webinar. And now we'll pass it back to Nicola and team for the Q&A session. We've got some good time left to do that.
Amazing. Thank you so much, Lauren and Joanne. Excellent presentation. It was very clear. It was very succinct, and I learned a lot also from the presentation. So very much appreciate that. So we're going to open it up to a Q&A. So if you have any questions for Empower Advocacy or for us at DDC, please write your question in the Q&A. I don't believe the chat, I don't think you can write your question in the chat, but there is a Q&A and you can send your questions through there and we will read them out. So I'll give folks maybe a couple minutes or maybe a minute if they're thinking or contemplating questions, and don't be shy. There's no such thing as a silly question or a wrong question. This is an opportunity for all of us to learn as we learn together. I mean, we're super excited that we're now in a position at Defeat Duchenne Canada that we can actually advocate for access to a treatment. You know, we've just had our very first treatment approved by Health Canada. It's been a long-term waiting. We hope that this is going to be the one of many to come. And so we're super excited for what the future holds for us. But with that comes a lot of work, and that is going to be focusing around our advocacy efforts. So any questions from the audience?
Nicola, maybe while we're waiting, if there aren't any quite yet,
Yeah.
I'm happy to share a question that we get very often, just to get us started. One of those questions is, what can I do now? So often, you know, we're speaking to patient groups and patient communities at this time when perhaps, you know, a new drug is coming, you know, it's been approved, but it hasn't gone through, you know, all these processes yet, and it's unclear, you know, what the role of an advocate, an individual advocate would be at this stage. And when we get that question, you know, we're so pleased to be able to say, this is the time to start building relationships. Because if you remember back at the, you know, the slide about knowing who your target is and all, you know, the progression of, you know, starting in one place and escalating to another, at some point, each and every one of you within the community, you know, may be called upon or may decide to engage in advocacy. And it will be at the provincial level at this stage, especially with this treatment that's already been approved by Health Canada. So this is the time to reach out to your local provincial elected official, introduce yourself if you don't know them already, and tell them a little bit about yourself and your family. Tell them a little bit about Duchenne. You know, they probably haven't heard of it before. So, you know, use this time to educate and inform and go to a decision maker before you need to ask them for anything. It really is that perfect window of opportunity to do that. So that's just one question that we often get in this sort of in-between time when people aren't really sure what they can do.
And to build on that, as we spoke about in the webinar, this is also a great time to start building your personal story and, you know, thinking about those different pieces that you will need when you are ready to start executing on advocacy and having those informal meetings with your local elected officials where you're just there to introduce yourself and share a bit about yourself is a great way to practice telling that personal story.
No, that's great. And as Joanne and Lauren had alluded to earlier as well, is Defeat Duchenne Canada is working on putting together an advocacy toolkit. Uh, and part of that toolkit includes some letter templates that you can utilize. So if you're eager to get out there tomorrow and you want some help or you need something, just reach out. We do have those materials almost ready to go, but we can have them ready to go sooner as soon as we can. And the great part is the third webinar that we're going to be holding later on in the next month. We'll have an opportunity to go through a lot of those tools and also talk about your stories. So I think that's such a great thing to be thinking about now is building that story, writing your story, and bring that to the next webinar with you, and we can build on that as we go. So the whole idea around this advocacy series is to for all of us to learn how we can become better advocates, but also put it into action because there's going to be a lot of need for us to action on getting access to medicines. That's a big priority for the organization. In addition, is also access to care. I've been having a lot of conversations with families as well about access in adult care as well, which is another big priority for the organization. So please reach out to us anytime if you want to learn more about how you can get involved and what you need to do that. So I don't see any questions coming in. So we have a quiet group tonight. That's okay. If you think of something later, please reach out. But I want to thank Joanne and Lauren. It's always a pleasure working with both of you. And I really do appreciate not only your time, but also your dedication to our Duchenne community. So thank you for that. And then just a reminder to everybody else as well that we will be having a third part to this, and this is going to be happening on a special day for us. It's Rare Disease Day, which is going to be Saturday, February the 28th. So mark your calendars to add that to your calendar that we're going to have the third part of this series, and that's going to be more of a working meeting, I think, right? Because we're going to be going through the toolkit and looking at those stories and talking about how we put it all into action. So it's going to be really exciting. Oh, I do see something Bonnie posted. She says, not a question. She says, as a decision coach, this process reflects the work I do with families, especially deciding on clinical trials. You're absolutely right, Bonnie. And advocacy is on so many levels, right? It's not just about access to medicines, not just about access to care, but access to clinical trials. It's all of that. And Bonnie is based out of the London Health Sciences in London, Ontario, but she helps families from all across the country. She is a decision coach. They have a fantastic program. So if you want to learn more about that too, just reach out because we can certainly put you in touch with the right folks. So thanks, Bonnie, for that. And so, with all of that, I think I'm going to pass it back to William to close out this session for now. Thank you, ladies. And just a reminder, if you're part of our advocacy committee or you would like to be part of our advocacy committee, please feel free to stay on the line after William closes us out because we will open it up for a little bit of a discussion with our committee. All right. So, William, thank you. I'll pass it over to you.
Okay, great. Thank you, Nicola. If you, well, we would love you to follow us on our socials. As you can see, we're all over the internet, and you can find us at Defeat Duchenne, at Defeat Duchenne and hashtag Defeat Duchenne on the various platforms. Next slide, please. And also, too, we have a newsletter, a monthly newsletter. And if you would like to sign up for the newsletter, if you're not already signed up, you can find it at defeatduchenne.ca. And the next. And then, of course, we want to hear back from you. You get your feedback about today's webinar. It's really important to get this feedback so that we can improve what we're offering to folks and get your feedback on content and whatnot. So I have put the link in the chat for everyone. I'm going to put it in there again. So please copy and paste that link and fill it out. It will only take a couple minutes. There's just a few questions. And yeah, that is everything. So thank you so much. We're really happy that you joined us. And again, as Nicholas said, for those folks that are on the advocacy committee or who want to join the advocacy committee, please feel free to stay behind with us for a little bit, and we can have a bit of a conversation. Thank you.